Coronavirus disease, or COVID-19, is a respiratory illness caused by a coronavirus first identified in Wuhan in China. This has now spread internationally and has now hit the shores of South Africa. So the big question is, what does it mean for you and I? Should we be worried? What are the chances that there'll be massive spread here at home? And if that happens, will the country be ready for that? But who's at risk of contracting this illness? And perhaps the most important question is, how can we prevent spread of the virus, and how can you and I protect ourselves from contracting the virus? Now, we'll tackle this and much more in today's show when we look at the coronavirus. But for now, our senior producer, Zama Buthelezi, will take us through some of the global stats around this condition. Welcome, Zama. What are the numbers looking like today?
Well, Silo, according to the World Health Organization, and these figures are as of yesterday, the world has recorded at least 110,000 infections with at least 3,800 deaths thus far.
Right. So we believe that obviously there are countries that are affected more than the others, and we have some information in terms of the top 6 countries in the world that have been affected the most. What's the situation like here?
Well, we'll start with China, where the outbreak started. The infections so far, we're standing at 80,904, and with 3,123 deaths. And then we move to South Korea at 7,382 infections, recording 51 deaths. And Italy, 7,375 with 366 deaths. France following at 1,116 infections, recording 19 deaths. Germany at 1,112, not far from France, with infections, 0 deaths so far. And Spain at 589 infections recorded with at least 10 deaths.
It's quite interesting, just looking at the numbers. I mean, Italy and South Korea has almost similar number of, cases confirmed.
Definitely.
But the mortality rate, in fact, Italy has the highest mortality rate, sitting at 4.96%, as compared to only 0.69 in South Korea. So, in the African continent, what are we looking like?
Compared to the globe, you look at countries like Algeria with 20 infections and no deaths recorded so far. Senegal at 4 with 0 deaths recorded so far. Egypt at 55 with only 1 death recorded so far. Morocco 2 infections and no deaths recorded. Nigeria 2 also, just like Morocco, so far no deaths recorded. And South Africa recently recording 7 infections with no deaths so far. And according to the minister, he talks about how these 7 cases are of those South African citizens who went skiing in Italy recently. And all these members who are here have been quarantined as per the officials from the Department of Health. But as we have seen in other countries, the numbers can change.
Right. It can change drastically. But at least we know that in South Africa, I mean, we know where those 7 cases come from.
Yes.
It's the group of 10 that visited Italy, as you said. So I believe that the WHO has put together, in fact, not just the WHO, NICD, a set of some protective measures that you and I can follow in protecting ourselves.
Yes, protect ourselves and others as well. As usual, we need to wash our hands frequently and maintain social standing. Right. So no hugging and kissing.
Wow.
And also avoiding touching your nose, your eyes, and your mouth. And practice respiratory hygiene.
Yeah.
And also, if you have a fever, if you have a cough, and if you have difficulty when it comes to breathing, you are urged to contact your doctor immediately. But this, you cannot just take a taxi or take a train and go and see your doctor.
Right.
You call or you Skype with your doctor just to protect yourself as well as other people.
Right.
And lastly, Silo, there is a toll-free number from the NICD. It is very important that if you need information, you call this number. The people there are available from Monday to Friday from 8 to 4 p.m. 8 in the morning. The number is a toll-free number, 0800-029-999. Back to you, Silo.
That's a very, very important number, and we'll try and display it throughout our show today. And yeah, thank you very much, Zama, for sharing that information with us.
Thank
With
you.
our senior producer for Health Talk, Zama Buteles. Now, of course, to help us understand, this disease a lot more, we're going to have the head of the Center for Enteric Diseases and from the National Institute of Communicable Diseases, or NICD, and we'll also be joining some people via Skype. Firstly, a South African English teacher currently based in south of Wuhan in China, and we'll also cross to link up with another South African student, this time based in South Korea. And of course, we'll also be joined by the mother of this student who's based here in South Africa, in Mafike. Now, we invite you to be part of the show by asking the panel some questions or simply just sharing your views with us. The number to call is Johannesburg 714-5861 or 5877. And if you have any question around this subject, please call us. And yeah, you can be part of the show, as we said, and otherwise you can tweet us at SABC Health Talk or simply just interact with us on our Facebook page, SABC Health Talk. So sit back, relax, and learn from this bumper show coming to you just after a short break. I'm Dr. Solomon Tau, and this is Health Talk.
So I think the important thing for your listeners to know, or watchers to know, is that South Africa is prepared for this virus. So South Africa has really been monitoring the situation evolving in China from the very start, when it was just a small cluster of cases. And we have released guidelines that have been widely distributed to healthcare workers, both in the private sector and in the public sector, to make sure that all healthcare workers are aware of the virus. How do patients present? And so they'll rapidly pick up any case. And then should they identify a possible case, healthcare workers have got guidance about how to isolate the patient so that there's no onward transmission, and then how to take the right samples and transport them to the NICD so that we can confirm the diagnosis. In addition, we are screening at the ports of entry for people coming in with fever, and all the staff at the ports of entry are aware of what to do should there be an imported case.
All right, so let's just try and unpack the story of coronavirus. In fact, with breaking news is that the 6 new confirmed cases in South Africa, bringing the total number of confirmed cases to 13. And of course, we heard yesterday that the one person that was admitted to hospital has in fact just been discharged. And to help us take us through all of these issues and to answer all of the questions related to coronavirus or COVID-19 is Dr. Gina Thomas, who's the head of Center for Enteric Diseases at the National Institute for Communicable Diseases, or the NICD. Welcome to Health Talk, Dr. Thomas.
Thank you.
All right, perhaps let's just start from the beginning. I mean, we said people know coronavirus. Now there's COVID-19. Just help us with the terminology. What is this?
So coronaviruses are a group of viruses that cause disease in many animal types. There are many different types of coronavirus.
Right.
And there are coronaviruses in humans that cause very mild disease, almost like colds. But then there are some coronaviruses that are animal viruses that from time to time jump across the species into humans and then can be transmitted from human to human. The first such coronavirus was the SARS coronavirus that emerged in 2003. The second is one called MERS coronavirus that has been circulating predominantly in the Middle East. And then we have this novel coronavirus that emerged in China in December of last year.
Right.
So this new virus that emerged in China is actually very closely related to the SARS coronavirus of 2003. So the actual terminology is that it's SARS-CoV-2 because it's so closely related.
Right.
But the disease that this coronavirus causes is called coronavirus disease 19. So that's why we shorten it to COVID-19.
19 as in 2019.
2019 is when the first cases were detected in China, yes.
All right. So let's just take it from there then. I mean, the first cases were detected in China. In fact, that's where the biggest number of infected people are. Let's just try and look at this outbreak. Just try and understand how this thing just spread so, vastly, if you can put it that. I mean, we've heard that we now have 13 cases here. We don't have much detail about the new 6 cases. I suppose we expected 10, but 13. But anyway, we'll come back to South Africa. Let's just look at the whole outbreak and how matters developed from December till now.
So it's thought to have originated from a food market in Wuhan, where there were many species of animals, wild animals and domestic animals, and different types of food for sale. And then there's very close contact between many different species of animals and humans. And the first cluster of cases of severe pneumonia in Wuhan were linked to some kind of contact with this marketplace. And because it was a new disease and tested negative for all the typical viruses and bacteria that we test for in pneumonia patients. Exactly, that we know about.
Right.
It took some time for them to identify that this was a new virus that no one had seen before causing this illness. When you've got a very populous city like Wuhan is, and you've got very close contact between people, while you're trying to figure out what the cause of a new disease may be, there's the opportunity for person-to-person transmission. So, that delay when scientists were still trying to figure out what was causing these illnesses and how many illnesses were linked, gave the virus a chance to transmit more broadly across the population and the communities there.
Right. So I mean, looking at all the different, we just went through some statistics looking at the top 6 most affected countries. It appears that Italy has been worst hit in terms of mortality. I mean, the number of cases are obviously incomparable to that of China, but it begs the question: how has the world reacted to this outbreak, starting with China and going to these other countries?
So, I mean, China, as everyone's aware, took very drastic and, in some senses, draconian measures and locked down Wuhan and did really aggressive testing and case finding and contact tracing in order to try and contain the virus spread. And in many senses, it was quite successful in that the spread outside of Hubei province, where Wuhan was located, into other Chinese provinces and cities was in fact minimal, looking at the total population in China per se. Right. In terms of the responses in other countries, it's been very varied. I think one of the difficulties was the major unknown. We didn't know how easily transmissible the virus was, what the incubation period was, if people who were just mildly symptomatic could still transmit virus before they became severely ill, or people who were still incubating could transmit the virus. So different countries had different responses in terms of protective measures.
Right.
Some cancelled flights arriving from China. Some instituted quarantine measures for people arriving from countries where there was localized transmission. So I think every country's response has been different and also guided by their particular risk profile.
All right. So let's come back home now and to kind of examine, because many people are asking the question, Is South Africa ready? Are we ready for another outbreak? Firstly, what are the chances that we will have this massive spread? And how have we responded, or how are we responding to this coronavirus issue?
So, I mean, as we've seen, we have got imported cases now from countries where there is an established outbreak with local transmission. And, you know, I think the probability that we will get some local transmission is likely very high. You know, many countries that are developed first world settings that have had very stringent controls in place to try and identify imported cases early and contain it, have had local transmission as well. So it won't be unexpected that we do get some local transmission. It's all about how we respond to that.
Right.
I think in terms of laboratory testing preparedness, we are prepared. The NICD lab team that's dealing with the virus has been extremely proactive from the beginning, setting up and validating the tests. And now, in fact, the private sector laboratories, which also have, you know, extremely sophisticated technology and very skilled pathologists and laboratorians, have also undertaken to do coronavirus testing. So we have the capacity to do the testing.
All right. So the testing is not just centralized at NICD, but
No.
all the other private facilities can.
Precisely.
There appears to be, well, there's protocols that, you know, are followed, generally speaking. I mean, you know, perhaps the question is, what is the mandate of the NICD in this whole matter?
So the NICD's mandate is to support the Department of Health with all communicable disease, public health related activities. So obviously we have the specialized reference laboratory. We have subject matter experts like Professor Cohen and Professor van Gotberg in the respiratory unit that deal, you know, on a constant basis with world experts and the World Health Organization in order to have up-to-date, evidence-based, you know, scientific knowledge that they then use to guide departments of health for their policy and strategy, you know, frameworks.
Right.
We also do have an emergency operations center on site at the NICD, which is used as a hub to organize, you know, a lot of the activities around coronavirus.
Okay, we're going to talk a little more about, you know, the hospitalization and who needs to be hospitalized and where and that sort of thing. I believe we have a caller on the line. We'll just take that call before we go on a break. Welcome to Health Talk. Hello. I'm sorry, I just didn't get your name.
Oh, my name is Stacey Majam.
Well, welcome, ma'am.
Yes, actually, sir, my question is about the people of the ambulances.
Yes.
How safety are the people of the ambulances? Just because those people, they are transporting the patient from home to hospital,
Right.
and they are not wearing anything, and they are transporting multiple people. How are they going to see that one is now corona?
Excellent question. We're going to come back to that. We're going to go for a quick break. When we come back, we're going to try and answer all of those questions, including that from the last caller. For now, please stay with us. Okay, welcome back. We are still with Dr. Gina Thomas, Head of Center for Enteric Diseases at the NICD. We're talking, obviously, COVID. And we're going to be joined later by, firstly, Nkululeko Nkuta, who's based in Guangzhou in south of Wuhan in China. Now, Nkululeko works as a Wall Street English teacher at that place. Welcome to Health Talk, Nkululeko. Okay, there's going to be a bit of a delay because, I mean, obviously these people are far away. We also have Keo Lobelo, who's based in Changum in South Korea. Now, she is a PhD candidate at Hanseo University over there in South Korea. And welcome to Health Talk, Keo. All right, I'm going to be coming back to you just now, but perhaps let's start with you here, Dr. Thomas, and talk about, transmission of the virus, because I think people need to understand how this virus can be transmitted from one person to the other and who's at risk. I mean, Sefi asked a question to say, what about people that, paramedics working in ambulances and that sort of thing? I mean, they are in contact, direct contact with people that are normally sick, and it's possible that any of those could be having the virus.
So the virus is transmitted by what we call respiratory droplets.
Right.
So when a sick person sneezes or coughs, they're microscopic tiny droplets that are released, and you can't see them with the naked eye, and they contain virus. So anyone who's within a very close proximity, and it's generally recognized to be less than a meter, might inhale or breathe in those little droplets that are then expelled by the infected person. But also importantly is that these tiny droplets land in the environment. So they land on surfaces and objects, and then other people who can come into contact with the surfaces or objects then can touch their hands, touch their nose, their mouth, their eyes, and then the virus gets into contact with these mucous membranes, and then it allows the virus to infect that person. So
in essence, you need to be close to a person that is infected, that is transmitting the virus. We'll come back to who can transmit and under what circumstances. And secondly, that if you're within a reasonable distance and the person sneezes or coughs, whatever you touch around you, and get your hands to your face, your nose, and that sort of, that's how you will get the virus into you.
exactly.
Right. So let's talk then about the risk of transmission. I mean, clearly you're saying you need to be close, in close contact. But ambulance workers, a call from Sefi.
So ambulance workers obviously will be in very close contact with ill patients. And it is important that all emergency medical services personnel take adequate protection at all times. And so this is not just for COVID-19, but there are many other respiratory infections that ambulance workers and healthcare workers in general can be exposed to. During the influenza season, influenza is also highly transmissible and in exactly the same way by respiratory droplets. So I think
mainly all other viral illnesses, isn't that so?
Many other respiratory viral illnesses are spread in exactly the same way. And I think at this stage there's been heightened awareness because of COVID-19 around the risks of respiratory virus transmission. So the EMS personnel, as far as I know, have also been included in intensive training recently. And the Department of Health is prioritizing the supply of personal protective equipment to healthcare workers, and this will include EMS personnel.
All right. And just very briefly, I mean, we know that it's a respiratory illness, but just so that, we're all on the same page, typical clinical signs and symptoms. How will you know that somebody has a respiratory illness?
Right. So the typical signs and symptoms of COVID-19 disease are a fever and cough. Many people also become very tired and lethargic. Some people, if they have more severe disease, will experience shortness of breath. And if you listen to these symptoms, it's very similar to many other symptoms we get throughout the year when we get summer colds, to the winter time when we get influenza, as well as all sorts of other respiratory illnesses. So it can be very non-specific.
Non-specific, like many other illnesses.
Like many other respiratory illnesses.
Okay, I'll tell you what, let's try and connect with our guests out both in in China, south of Wuhan, and in South Korea. Let's start with Nkululeko. Nkululeko, welcome once again. Just briefly tell us about your situation in China over there.
So at the moment, some of the infections decreased substantially.
Yeah. Nkululeko, I'm afraid yeah, I'm afraid we're struggling to get a clear line. Whilst we work on that, let's see if we can get a clearer one from Geo. Geo, how about you there in South Korea? What's the situation like with you?
Well, so we're doing okay right for now. But I personally was in isolation for about 2 weeks because I had visited a city. I visited Busan, which is outside of my city. And during that time, it was a bit tricky to be home and not be able to go out. But once I got used to the daily routine, I was just okay with it. But I think now it's not as scary as when it first began.
Right. But what are you guys restricted in terms of where to go and that sort of thing, where you are now?
Currently, where I am right now, the school has issued out a notice that we should be very careful about leaving town. So today, there's been 8 confirmed cases of people that are infected in our city. And so we're told not to go to the city center and just stay around campus because that's where, there's nobody who's infected or any cases reported. So currently we're just around the campus village.
And any restrictions at the university itself? I mean, any known cases? Are you guys taking any precautions?
Definitely. Some of the offices are not open. The school library has been closed. Only people that work at the library are there. I work with the international office as well. If there are students that need to see any of the assistants that are from their countries, they need to meet with them outside. People are being checked their temperatures as well as on the hour, washing our hands and sanitizing and just making sure that we are staying clear of big crowds. So if there has to be more than 15 people, it's a no-go. We're not doing that.
All right. Of course, in this day of social media and all the technology available, you are able to communicate with your loved ones back here at home in South Africa, and you keep them informed. Obviously, do you have any concerns yourself over there? I mean, are you feeling safe?
You see, at first I was a little bit panicked, but for the fact that I talk to my mom every single day and the rest of my friends and family, it's not so much of a panic anymore. I think knowing that the healthcare system this side is very good and efficient, I'm okay with that. Whereas I would risk traveling to go home and then I contract the disease on my way home. So I'd rather just stay put and just continue and see what's going to happen.
Right. And in terms of the information given to you guys at university about, the coronavirus situation, perhaps, insofar as it is in South Korea, how is that going?
There's information everywhere. So there's an app that you can check the reported cases as well as the recovery cases. And for now, there's a lot of recovery cases, which gives one hope that at least there is, a silver lining at the end of this whole thing. People are not just dying, people are recovering. So which makes us feel a little bit safe. So there are posters everywhere, messages, emergency alerts are sent out to our phones. Every single time there's a case that is, either suspected or confirmed, there are messages coming through.
All right. And of course, you appear relaxed. I mean, this whole thing hasn't affected your studies at all, and you're looking forward to coming back home sometime?
Well, at the beginning it did, because February is a time where graduations are happening in South Korea. And I had just completed my master's. My family was going to come for my graduation, but because the rise of the COVID happened, graduations were canceled. That, I'm not going to lie, took a toll on me. It broke me a little bit, because I was expecting to see my family. I haven't seen my family in over a year and a half now. And the fact that graduations were canceled, that affected me a little bit emotionally and mentally. But I think now I'm getting over it, because, PhD candidate, the girl's moving.
Right. Gio, it was such a lovely time chatting to you, and we just want to wish you well. Look after yourself, and we'll see you back home with a new qualification from South Korea. Well,
thank you very much.
All right.
Thank you very much.
Okay, dokes. Now we're back to our studio here in Johannesburg, and it's now time to go for a quick break. When we come back, we'll try and link up with Nkululeko one more time. Please stay with us. Okay, welcome back. We're talking about coronavirus, and you've just heard we've spoken to Kio, who's based out in South Korea. We had a wonderful chat. She seems relaxed. Everything is under control there. Of course, here in our studio, we have Dr. Gina Thomas, head of the Center for Enteric Diseases at the NICD. Earlier, we tried speaking to Nkululeko Nkuta, who's based in China, but we struggled a bit. I think we should be in a position to speak to him now. Nkululeko, are you there?
Yes, I'm here.
Oh, great stuff. So we were chatting with Kyo just a few minutes ago, who's based in South Korea. Now, you are in China, just south of that province of Wahun. Just tell us a little bit about the situation that you currently are under.
So it basically started about the end of January, when there was a bit of panic regarding people getting sick. And over the next couple of days, we saw a number of new infections, and infections increased. And I went to Vietnam for a short holiday, and when I came back, my city was basically on lockdown. This was around the beginning of February, and that meant that when I got here, I had to go straight back home and wear a mask. And the rule was for most people that you would stay indoors, you wouldn't go to work, and you would wear a mask whenever you're outside. If you weren't wearing a mask, you could be fined by the police if you were caught, just for public security purposes. And at all the buildings, they would have the security guards limiting people who weren't living in that specific building. And the security guards would check your temperature when you went in and out of the building. The same would be for the malls as well. And so we got a lot of communication as time went by, but gradually as the disease sort of increased, we saw increased infections, there was a bit of panic, a lot of fear from a lot of expats. However, in the last week or so, we've seen a dramatic decrease in the number of new infections, and things are almost going back to normal. Stores are opening, people are slowly going back to work. Most of us teachers are working online at the moment, and the malls are sort of starting to get packed up a little bit more.
Right. So obviously you are aware that, I mean, all those, let's call them draconian measures that, had to be taken are starting to bear fruit. Right.
Yes, certainly. So basically the first week or so, you literally didn't see anyone on the street. When I went to the supermarket, there were about maybe 5 to 10 people in totality, but just limiting movement alone just made sure that people, one, were more aware of being cautious and quarantining themselves if they were sick, and it sort of made the process a little bit easier to follow, that if you were sick, you were tracked, and you would be avoided from potentially infecting other people. So, I mean, all in all, it worked out pretty well.
Okay. How about you personally? I mean, did you feel trapped to a point where you wanted to come back home?
At the beginning, I was a little bit fearful. My family called me regularly to sort of understand what the situation was and asked me to come home. But my thinking was about a week into February that it would be a lot more dangerous for me to come home than to actually stay in China quarantined. Because here I can control myself and I don't have to worry about the fear of being infected either at the airport or at the airline. So it's been okay. I'm used to being by myself. So it hasn't been too difficult, and I just kept myself busy for most of the time.
All right. And what's your plan for the next in the immediate future?
We're not sure yet. So the unfortunate impact of the virus is that a lot of companies have closed, and so they haven't been able to push sales. So there's a bit of financial strain on a number of different businesses, especially English teaching, with the fact that they can't see students regularly. So there's some uncertainty regarding that. We've seen that in some situations, schools are either paying teachers partially for the duration that they were of the virus, or sometimes in severe cases that people are not being paid at all. So at the moment, we aren't entirely sure. There's some slight assurance from the company that things will get a little bit better in the future. However, we're still in a bit of limbo at the moment. So the idea is to continue staying and wait for things to clear up before considering coming back home.
Okay, but the positive thing is that you're saying things are getting back to normal. Nkululeko, I want to thank you very much for chatting to us. And yeah, look after yourself. We'll see you back home sometime soon.
Thank you very much.
All right. And just before we speak to Keo's mom, just to get a sense of, I mean, you've heard the situation for both South Korea and you know, south of Wahun, and in terms of how these countries have reacted. We started talking about this earlier. Your comments?
So, as mentioned earlier, China, once they knew they had a problem in Wuhan, were very aggressive and proactive in terms of their isolation and quarantine practices. And the lockdown, as I said, you know, was likely very effective. And South Korea has also been extremely proactive in case finding, in contact tracing, in making sure they limit social gatherings and social distancing. And we know that it's social interaction and it's close contact that spreads the virus.
Right.
So those measures, to a large extent, are successful, but it also depends on how feasible or practical they are, and they might not be practical in every situation elsewhere in the world, and they may not have the same impact elsewhere in the world either. And I think that every country has to you know, be guided by their own demographics and, you know, how practical various control measures are to implement.
Right. Yeah, but this whole notion of self-quarantine or quarantine in general, I mean, does work because it contains spread, isn't that so?
It does contain spread to an extent, but there are always the unknowns.
Right.
I mean, South Korea, you know, was doing quarantine from the very beginning, and, you know, very strict self-quarantine and isolation, and yet there was local transmission. Right. And the same can be said of many European countries, where they were aggressively screening and implemented quarantine and self-isolation, and yet there was community transmission.
All right, okay. At this stage, we want to just get back and speak to Keo's mom, Maduo Lobelo, and who's been listening to us here, and of course watched or listened to her daughter and watched her daughter, who's looking bubbly and quite relaxed. Maduo, welcome to Health Talk.
Thank you very much, sir.
All right. So we've just had a chat with your daughter, and we just thought, let's, you know, touch base with you, see where you are in terms of any concerns that you have, perhaps.
For now, I do not have that much of worry. It's just a concern, but because South Korea is very active in terms of making sure they do everything to the book, so I'm not that much worried.
Yeah. I mean, she herself looked quite comfortable. She's quite confident that, you know, the authorities over there are looking well after the situation and have everything under control. And yeah, which of course is quite helpful to you, isn't that so?
It is, but the only impact was when we could not go for the graduations. That blew us.
Right.
But we have no control over that.
Right. And again, the other important thing that she mentioned was the communication, that she communicates with you almost on a daily basis.
Yes, we talk almost 3 times a year.
Right.
Yeah.
Right.
We're constantly on the phone.
Yeah.
So I'm not much worried because we're sharp.
Right. So of course she's not planning to come home anytime soon, but in the event that she does decide that she wants to come home, have you been made aware of, what's likely to happen when she can come home now?
Yes, I have been following this coronavirus story closely, and I think we would just wait and see what happens. If we have if we're not supposed to see her for 21 days, but I thought back to 21 days, so we will wait.
All right. But you'd
better safe than sorry.
Right. You'd know that it would be for a very good reason, isn't that so?
Yes.
All right. Well, Mema Dua, thank you so much for chatting to us, and we wish you and your daughter very well going forward.
Thank you very much, sir.
Great stuff. Okay, time for another quick break. When we come back, we'll continue our story on coronavirus and touch on that very, very most important aspect of this entire show, how you and I can protect ourselves from getting infected. Please stay with us. Welcome back. We're talking coronavirus or COVID-19 with Dr. Gina Thomas, Head of Enteric Diseases from the NICD. Dr. Thomas, we have just a few minutes left. Let's just put it all together now. And I'd like us to focus this time on how the general public can protect themselves. Firstly, let's talk about the risk of, contamination. Questions like, I have a trip planned. I've planned this trip for the last 2 years, and I'm going somewhere in Europe, okay, some country not far from Italy. What should I be doing? Should I cancel my trip? My trip? Somebody says, okay, my neighbor's child tells me that, the school that she goes to, the teacher there recently traveled somewhere overseas, not sure what. What should I be doing because my child plays with the child next door, that sort of thing. Can we deal with all of these issues and perhaps try and put them into perspective?
So traveling to a country where there is established and ongoing local transmission obviously does pose a risk. As we've seen with the recent cases in our country, it was following a ski trip to Italy. So I think especially if you're in a high-risk group, so if you're elderly, if you have pre-existing health conditions like lung and heart conditions, or you have cancer or diabetes, that you are at higher risk for getting severe disease if you do become infected. Right. So I think it's just a close evaluation of whether it's essential travel or not. Yeah. And then it depends on the country you're going to. Some countries have just had a few imported cases and don't have ongoing local transmission.
Right. Before we carry on, I believe we have Rodney on the line. Rodney, welcome. Is Rodney with us? Rodney?
Yes, I'm with you guys. Yes, I can hear you.
Right. Carry on, Rodney. Your question or comment, please?
Okay. So, I've actually got a comment because I'm calling from the Johannesburg CBD.
Right.
And I want to know what is the government doing about it, because today I took a day off at work to try and look for sanitizers and whatnot, and those things are not actually in the shops.
Right.
Do you understand?
Okay.
So is there an easier way of accessing this kind of things?
All right. Okay. Excellent question. Thank you so much, Rodney. It comes to the question of personal hygiene. People talk about washing hands. Are sanitizers the only way? These things cost a lot of money.
So washing hands with soap and water, and as long as you do it thoroughly, and it's usually that you have to be able to sing happy birthday twice, and then you've been washing your hands for long enough, that's still the most effective way to clean your hands. Hand sanitizers do work, but they should have at least 60% alcohol in, And they don't work if your hands are visibly dirty, because they can only work if your hands have got no dirt on them. They can't penetrate through dirt onto your skin.
Right.
So washing hands with soap and water is still the most effective. Hand sanitizers are an option when you can't wash your hands or your hands are not visibly dirty.
Okay. The question of masks, people are, some people are crazy around the issue of getting masks around.
So masks are only for sick people and for healthcare workers that are caring for sick people. There is no evidence that wearing a mask, if you are a healthy person, is of any benefit. And in fact, then if healthy people wear masks, then it means that less masks are available for sick people and healthcare workers who really need it, because there is a shortage of masks at the moment.
Okay. Somebody says, I suspect that I may be having coronavirus because I may have come into contact with someone. I can't be sure because I went to a concert last night and there were 2 people there coughing around. Can I go get tested?
No. So as a member of the public, you can phone the helpline, and Zama did put the number up earlier, and get advice. I mean, you really have to have been in close contact with someone who's known or highly suspected to have COVID-19.
Right.
And should you develop any symptoms, then you should phone a healthcare practitioner or the hotline for them to give you advice as to whether you should be seen and tested or not.
Okay, we have 30 seconds left. Your final message to the public. Should we be worried? Should we panic?
So don't panic. Practice prevention, which is cough etiquette. So sneeze or cough into your bent elbow or onto a tissue. Practice hand hygiene. And the flu season is coming up.
Right.
So please get yourself vaccinated against the flu.
Right.
Because if we have coronavirus and flu at the same time, it will be a great strain on the healthcare resources. And also, just protect yourself against all infections as far as possible.
Well, thank you so much for that insightful. In fact, talk about the flu virus. The flu vaccine will actually be available towards the end of this month. Well, folks, this is how we come to the end of our show, and would like to thank you so much for staying with us. I hope that you gained as much as we all did here about this coronavirus. The basic message is, please don't panic. Until next time, do take care.